Nothing looks more beautiful in your 50s than sun protection in your 20s.
Oh, yes.
Right? It's a great line. So I told this to Jennifer Garner at an event I did with her a few years ago, and she's been using it ever since and quoting me. And we just did it together. I put it on my Instagram. I saw her again, and she was like, let's video that line. She just loves the line because it resonates. It's like the idea that you want to age gracefully, not helplessly. People who come in who say, I just want to age gracefully. Aging gracefully does not mean not doing anything. It doesn't mean that you're not going to either have little treatments or even a facelift. It means that you're wanting to look balanced and beautiful for any age. Like when somebody says, oh, you look good for your age, that to me is not a compliment.
Hi, I'm Kelly Namiro. Welcome to the Balancing Chaos podcast, a lifestyle podcast where we'll talk about wellness, motherhood, and some really exciting things in between. My goal is to help you develop a lifestyle that promotes health, wholeness, and success. Through my conversations with our experts and guests, I hope to inspire you to live a beautiful, full, and joyful life as you navigate balancing the chaos.
Hi, everybody. Welcome back to the Balancing Chaos podcast. Today, I am delighted to have a distinguished guest joining us on the show. Dr. Doris Day is not only a clinical associate professor of dermatology at the esteemed New York University Langone Medical Center, but she's also a trailblazer in the field of aesthetic dermatology. Her dedication to patient care, lifelong learning, and advancing dermatological techniques has earned her accolades and widespread recognition. Dr. Day's passion for educating others extends beyond the classroom as she regularly shares her expertise with audiences worldwide in both professional circles and through various media platforms. With a background that uniquely blends journalism and dermatology, Dr. Day brings a wealth of knowledge and insights to our discussion today. So we are going to dive into so many topics, ranging from the latest advancements in skincare to practical tips for maintaining healthy skin at every stage of life. Thank you so much for being on the show, Dr. Day. I'm so excited to chat with you.
Thanks for having me on and for that amazing introduction. I'll try to live up to all of that.
I have to say, I'm looking at your skin right now, and I know we're on a screen through Zoom, but your skin is amazing. It's incredible.
Aw,
Clearly you're
thank you.
living you're living
I
the.
try. It's a work in progress, but I'm very lucky in that my dad was a physician who was ahead of his time, and he saw the damage that UV rays did to the skin. So his line to me growing up was always, never go in the sun, never go in the sun. So he always taught me. I was in the library all summer doing book reports and studying. Summer is not vacation. So I was indoors a lot. And yeah, he made fun of me for that 10-minute time I sat in the backyard and tried to get a tan. He's like, you remember that time you sat in the sun? And now you're a dermatologist. I was like, Dad, I know. I sat in the sun for 10 minutes in my whole life. I know. So
Oh my gosh, that's so funny. So let's start there then. What
yeah.
is the truth behind that? Because I think that you hear so many different ends of the spectrum. And granted, there's so much information on social media these days, but there are two different influencers, let's say, quote unquote, that I follow. One of them, neither of them are doctors, but one of them is wearing the sun gloves, wearing the big hat, won't set foot in the sun. The other one is I don't wear sunscreen. I don't believe in sunscreen. We need vitamin D. So what's the real answer?
The real answer is kind of somewhere in between. I
Okay.
mean, I definitely think the sun is powerful for your health, your well-being, and being in the sun is so life affirming. Most of our dermatology meetings are in hot, sunny places, and we won't go unless it's in a nice, hot, sunny place. So
Yeah.
dermatologists love the outdoors and we love the sun. And I think the sun is vital for life and vital for your health. But I think you have to be sun smart.
Right.
So there's natural sources of vitamin D that are not from the sun. The vitamin D is naturally found in foods, and many foods are also fortified with vitamin D. So vitamin D is really critically important, but the skin's not the most efficient way to make vitamin D. And we don't even know that if you have a tan or a burn, or if you're older or estrogen depleted, how well or how efficiently your skin will make vitamin D from sun exposure. So I don't know that vitamin D is the excuse to get sun. Now, we know scientifically what UV rays do to the skin. We know that it causes something called matrix metalloproteinase, which is an enzyme that breaks down collagen. It can cause skin cancer, thymine dimers, very specific mutations. And the World Health Organization has put sun exposure, excess UV exposure in the same category as smoking. So would you tell somebody, well, your 10-year risk of getting lung cancer is you're not at that risk yet, so you don't have to quit yet. Don't worry about, go ahead and smoke. Or do we say quit smoking now before you have a problem? With sun, yeah, it takes decades before that exposure causes cancer, but don't tell someone to go out tanning because their risk of skin cancer is more than 10 years out. First of all, we see skin cancer in people in their 20s more and more now because the UV rays are stronger. And if you go to the tanning salon, it's up to 10 times stronger than natural UV rays. But we know that it causes premature aging, skin discoloration, blotches, collagen breakdown, and eventually skin cancer. Your genetics will drive how soon that happens. Like Christy Brinkley, it could be when you're 70, or if you're unlucky and you already have some genetic hits, it could be as young as in your 20s. And skin cancer can be deadly, but it's the most common cancer is skin cancer. Basal cell is the most common cancer, not just the most common skin cancer, but the most common cancer. So, and it's disfiguring. And eventually it could be deadly, but it's disfiguring. So we want to avoid that. And I would say getting sun is a good idea. And the idea of being sun smart is trying to avoid midday sun, being smart about applying sunscreen to more sensitive areas. I think the neck is the most important place to put sunscreen.
I feel like people would not expect you to say that. That's interesting.
The neck, because I've watched people age over the past 25, 30 years. And what I see is you can see beautiful face because we can do so much for it. And even right under the neck, the chin is a natural parasol. But then there's this line you see where the chin shadow wears off. And then you see this line of demarcation where the skin all of a sudden gets red and blotchy and crepey and like a plucked chicken. We actually call it poikiloderma of Savat, which translates in English to plucked chicken skin. So not a good look. And that crepiness, you can have a neck lift or a facelift. And if that skin quality is not good, then it doesn't matter how good a facelift you have, you're not going to look better because crepey, thin, sun-damaged skin is not pretty. It's not youthful. And it's not pretty. So protecting against there and going in an upward direction so you get the bottom of the neck, where if you go this from the chin down towards the chest, then you're getting right under the chin, but you don't get sunscreen at the bottom of the neck where you need it the most. So if you go in an upward direction, you're going to get the bottom of the neck and reapply it there the most often. Then the aging I see is in the lower face, around the mouth to the chin area. I see women with crepey cigarette paper skin that just looks like it's about to fall apart, and fillers there can help add back some volume, but too much filler, right? You'll look like a chipmunk and you want to improve skin quality. So that's another area where people need to protect. And then of course the whole face, but getting early morning sun for a few minutes helps your circadian rhythm. Being outdoors, biking, but wear sunglasses, wear a hat, wear some protective clothing, just be smart about it. And incidental sun exposure is the same as going to the beach. The sun doesn't count what your intentions are. You could be Mother Teresa doing God's work and you'll cry and get skin cancer. So look at the beach volleyball players, right? The Olympics, they're so gorgeous, right? They're tall, they're slim, they're so athletic, but they, to me, always look older. They look
aged. I think that's like, first of all, I think that the people who are listening to my show, at least the majority of them who I know, like, of course, we are all very health conscious. Like that's the basis and foundation of this show. But I think that a lot of us women, including my community, are also conscious of like aging and vanity and like what we're going to look like. And that piece is so important. And so when you have the information and the knowledge of what the sun is actually going to do to you, if you're in it too much and you're in that strong sun too much, it is such an incentivizer to, because it's like, you don't notice it the next day. It's not like this immediate reaction. It's like what you said, it's like 10 years down the line. And I look at the difference between my two grandmothers. One of them was like, I don't care. I'm in the sun all the time. I like not really going to take care of my skin. And the other one is so conscious. They've both had one facelift and my grandma who took care of her skin looks probably 20 years younger because she
Yeah.
didn't go out in the sun.
First of all, what you
Yeah,
said is not mutually exclusive. Wanting to
sure.
be natural and holistic and wanting to look good as you age, to me, goes together beautifully. And you have gorgeous
Yeah.
skin, by the way.
Oh,
So I
thank
think
you.
you're named after that good grandma, and you've been taking care of your skin, it looks like. And I can always
Thank
tell.
you.
But the other thing is, in 25 years of trying to help patients understand like the value of sun protection, I would say your 50-year-old self is sitting here telling you, please wear sunscreen. I would try all these lines. Then I came up with this line that is just my best line ever. I'm not embarrassed to say, obviously it doesn't sound so humble, but when you hear it, you'll agree. It's that nothing looks more beautiful in your 50s than sun protection in your 20s.
Oh, yes.
Right? It's a great line. So I told this to Jennifer Garner at an event I did with her a few years ago, and she's been using it ever since and quoting me. And we just did it together. I put it on my Instagram. I saw her again, and she was like, let's video that line. She just loves the line because it resonates. It's like the idea that you want to age gracefully, not helplessly. People who come in who say, I just want to age gracefully. Aging gracefully does not mean not doing anything. It doesn't mean that you're not going to either have little treatments or even a facelift. It means that you're wanting to look balanced and beautiful for any age. Like when somebody says, oh, you look good for your age, that to me is not a compliment. How about just saying you look beautiful?
Yeah.
So for any age. And I always tell people, oh, you look beautiful for any age. If somebody looks like they're 20 and they're 40 or 50, okay, well, then I'd say you look 20. I have patients now. I have somebody who came in and she was in her 70s and she was starting to complain that she was hitting her 70s. And I go, oh, that's just the baby. I have patients in their 90s. And I realize it kind of feels good when you say that. So when people start saying, oh, I'm getting old, I go, oh, you're just a baby. I've got patients 20 years older than you. And then you all of a sudden feel more youthful. So it's a mindset and it's an understanding that there is a holistic aspect to beauty, but it's different than saying, I'm not going to do anything. Because the reality is that we get pollution, stress, diet things, alcohol, not getting enough sleep, incidental sun exposure that accumulates, weight gain and loss, like all these things are affecting how our skin ages and how we look. So wanting to address those, whether it's by correcting them where we can when we get to it, like when it hits us that we have the bandwidth or the capacity to do it, or looking for treatments to reverse damage that was done, that is not conflicting with wanting to age gracefully or in a holistic way.
I love that you brought that piece of it up. And what that did was prompt something in my mind that I get asked all the time, because when I'm talking to women about health and their hormones, like my big thing is I want people to think about like, how can I be as thoughtful as I possibly can about what I put into my body, whether that's eating organically or I don't drink alcohol. Like there are so many things, but then I'm also a person who like, I'm going to go get my Botox, and people think that those two things are very conflicting. And like, why would you get Botox if you're not going to drink alcohol? I would love it if you could talk about the safety of Botox.
I tell everyone, I love people who go, I'll never get Botox. By the time I'm done talking to them, they're like, can I get it now? And I'm like, nope, you have to come back and ask me for it, because I don't want anyone to do it impulsively. But also, I personally think Botox is, my opinion is Botox is the safest drug known to mankind. I think it's safer than Tylenol, safer than so many over-the-counter products. But any drug is a poison if you take it wrong or you use it wrong. Any drug is problematic in that way. So it's not that Botox can't do harm. It can. If you use it wrong, if you do too much. I mean, I just saw on social media, it's winding through about a woman who had partial paralysis after Botox. And yeah, that can happen. You put in too much Botox, put in the wrong place. Like all these people getting Botox for trap tox for a longer neck, that's stupid. Like that's just, to me.
Or going to a person who's not qualified.
Yes, exactly. Yeah, Botox is a tool. It's like giving somebody a yard of fabric and having, a Prada outfit versus a flea market outfit. It's like the tool is just a tool. It's the finesse. I love when people say, how many units did you use? I'm like, what does that mean? It's not how many units, it's where it's placed. It's how it's placed. And it's understanding anatomy. The left and right side of the faces are different. You could see my right eye is higher, my right brow, and my right eye is a little bit bigger than my left. So I'm due for my Botox to even out my brows. I just
Balance
haven't.
it.
But it can even out your brows. It can balance your expressions. But the way that I look at it is I'm trying to redirect movement, not take it away. So I've posted so much over the past month about why I don't Botox my forehead. So I think I can fully, you can't really see here, but I can fully move my forehead.
Yeah, I can see. Yeah.
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 So my forehead, your forehead is, it's a functional movement. So what I've done is I've thought about this so much. And that's one good thing about creating content for me, is that I have to distill it down to what makes sense and how to get it through in English. Now, my background's in journalism, so I'm
You're good
used
at that.
to speaking in English, right? So, but now I'm realizing that I really, really, really have to get it. And what I've come to recently that has made me happy is that I understand in your face, you have two different types of movements. You have an expression, which is like furrowing your brows to say no, or you have a function. And raising your brows is not an expression. People go, oh, I'm so expressive, and they think they're raising their brows because they're expressive. And it's typically, it can be sometimes, but mostly it's a function of trying to open your eyes to show that you're present and you're engaged and that you're listening, or it's either convincing yourself or trying to convince the other person.
Right.
But your lids can start to get heavy and your brows can start to drop as young as in your 20s. So that expression of lifting your brows to talk, it's almost like moving your hands when you talk. It's really part of a function. Well, actually, that's an expression, but it's lifting your brows to get your eyelids out of your eyes, to open, to almost talk with your eyes.
Sure.
And if you keep inactivating the forehead muscle, you're removing the ability to raise your brows. And if you can't raise your brows, the opposing muscles will become stronger. So if you can't raise, you drop. So over time, you're atrophying the only elevator of your brows. Your forehead muscle is the only lifting muscle of your brows. And if you eliminate that, you weaken that muscle, you flatten the forehead, you drop your brows, you'll feel more tired, you'll age faster. So all this time we're talking about lift, 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 and then we take the strongest lifting muscle of the whole face and we go, I'm going to inactivate you. How does that make sense?
Right.
So the idea is not to say all or none. The idea is to look at somebody's movement, look where the pathology is. I give a whole talk that's called treat the source, don't chase the lines. So if I see somebody is always raising their brows, even at rest, it's because their brows have dropped or their eyelid muscles are weak and they're heavy. So I need to fix that. I either need to use a device that's going to help raise the brows. And if they're for surgery, they could do surgery, or we have devices like SoftWave that can raise, in my Fotona, that are great for raising the brows. Or we could do a little Botox between the brows because those muscles are pulling down and that can help lift. But that combination is going to lift the brows. And then you can use a little bit of Botox to balance the movement and address the deepest part of the line, but not take away the ability to do it. I want to take away the desire to do it, and then try to teach facial expressions that go differently. So I talk all the time about lifting the ears because I can pull my ears up. I've watched people, and if you lift your ears or try to squeeze your ears together, it gives you the same functional feel as raising your brows. So what I've learned to do is instead of raising my brows, I squeeze my ears. And over time, it's really helped to lift the face.
Oh, the
So
face back.
it pulls
That's
back.
really fascinating. See, this tells me two things. One is I feel like you have to have somebody who is an MD or
Yes.
like a doctor putting this stuff in your face because they
I
know
agree.
anatomy. Like if you're just going, and again, like I'm not trying to like generalize here and put people in a box, but if you're just going to somebody down the street who is like a, registered nurse, like it's just not as much knowledge and information about how facial anatomy and all of those muscles work together in order to be
Absolutely.
able to create the proper lift and still keep you looking like you're not this frozen,
Right.
plastic person. And I feel like that's the other beauty of what we see in, at least I've noticed New York versus Los Angeles. Like
Yes,
you go to New York and people look like human, and you go to LA and people are like,
I know. I
it's
know.
really, really an interesting, like, I don't know if it's
Dynamic.
technique or aesthetic, but yeah, like I would love to hear your thoughts, maybe on that a little bit more. Is it just like preference?
Yeah, I think it is. So there's a couple of things. One is there's New York, Miami, and LA. I would
Right?
say like the three kind of zones. Like I go to Miami and I
You're
just
blown
covered up most
away.
of the times. Yeah, I'm just like, whoa. But what happens is if you see the same things over and over, that becomes normalized. And so if
Right.
you see everybody having, I went to Dubai for a meeting and I came back and I was like, do I need filler on my lips? Because everybody there has like the biggest lips. My
Mm,
friend posted a thing and he called it lip gina. It's
mm.
like they're so big, they become like they're
Yeah.
just different lips after a while. But if you see something over and over, if you show women pictures of big lips, then they're going to want bigger lips. If you show them pictures of normal lips, and in Asia, it went in reverse for a while. In the past year or so, women were starting to get lip surgeries to make their lips smaller because they wanted to look more Western. So they were literally cutting their lips, surgically removing their lips to make them smaller. So people will do very drastic things to be in fashion or to match a certain culture, but it is partly because it's somebody decided to do it, whether it's the Kardashians or somebody after them, and
Right.
it becomes a version of that, or because it's it's just there's so many people out there doing it, and people don't understand that these have consequences. I was lucky enough to be one of the participants in the first FDA clinical trials for the first filler that available hyaluronic acid filler in the US, which was Restylane about 20 something years ago.
Wow.
So what I noticed in watching these patients over time, some of them I saw 10, 15, even longer after that, years later, is that the filler wasn't gone. The filler was still there. So the studies will last for a period of time, whether it's 6 months, 9 months, a year and a half, 2 years. And the amount of time that they do the studies is what they could claim as how long that product lasts. But the reality is, if you look at the data at the end of the study, it's still at peak or almost
Yeah.
peak. So the filler hasn't gone anywhere.
Dissolved.
And nobody studies what happens to that filler 5, 10, 15 years later. What happens as that filler starts to break down?
Right.
Because
And
filler,
also people are going every 6 to 9 months
yes,
to get more and
yes,
more and more because they think it's quote
yes,
unquote dissolved.
exactly,
Oh my God.
exactly, but they're trained to do that. So
Right.
all these med spas that are trained by the companies, they're told, put everybody on a schedule and make
Yeah.
sure they come back every 6 months to get their fillers because it's going to go away. And you can put a syringe anywhere. There's always room to put a syringe somewhere. This is what they teach. When the reality is no should be your number one word most of the time.
Yeah.
That there isn't always some place to put a syringe. And sometimes you're better off just saying no or looking at a device or a clear and brilliant or a light laser or a chemical peel. I love the carboxy. It's a CO2 lift for the face. It's a mask you do at home that is like a hyperbaric oxygen treatment for the face that will make it dewy and beautiful. And it's a great like day of the bride of the wedding
Yeah.
treatment, red carpet. There's so many fun things you can do, but you're not going to fall behind if you don't keep stuffing more in your face.
So what is it that could, or we aren't even sure yet, could happen, 15 to 20 years if you keep doing
Well, it
that
depends
filler?
on the filler and where it was placed. We're seeing around the eyes, you start to see it looking bluish because that's such a high around the eyes and around the mouth. These muscles, the orbicularis oculus and the orbicularis oris, so the eye muscle and the mouth muscle are round muscles.
Right.
So they are puckering. They move like a pucker or a purse string. And as they do that, the filler can migrate. The filler can move. Some fillers absorb water better than others. So we have close to 20 different hyaluronic acid fillers available today, and they are slightly different cross-linking. They're produced slightly differently. They're all made of hyaluronic acid, but what makes one product softer or thicker or more or less stiff has to do with the way that they're cross-linked. How many cross-links, how long the particles are they all the same size? Are they different sizes? There's so many, how much total hyaluronic acid is there? So there's all these different factors. And some of them, as those bonds break and they break down, they start to absorb more water. And that can make a filler swell even a year or two later. So we're seeing people with swelling around the eyes that could be 5 years later, and they're like, oh no, the filler's gone. But now we can look with ultrasound and we see, no, the filler is still there. And that
Wow.
breakdown phase can last for years. And it's not always easy to dissolve the filler. When I do
Right.
filler around the eyes, the only product I'll use is Restylane, because it's a gel, it's a particle, not a gel. It doesn't integrate well, which is good. I don't want it to, which also makes it easier to dissolve. And I'll use a tenth of a syringe, or just maybe 0.2 cc's. And I'll use a cannula just to lay down just a little sheet and as close to the bone as I can, because that won't absorb water. I know how it behaves 5-10 years later because it's been out for 20 years. It's the one I did the studies on. And it is very predictable and reliable. And because it doesn't integrate, if I need it to dissolve, it's easier to reach. So, so for me, that's the safest product, but a little bit goes a long way. It's not, you're not trying to correct to 100% in the first visit, although oftentimes it's all you need. It's just people think I have to shove a good amount of filler in there to get that filled. And also, it's normal to have a tear trough. Like, you have a functional separation from one part of your face to another, and it's okay. So, and then sometimes, honestly, it's just saying that it needs surgery. Like, if you need surgery, it's the answer. So just being honest about what you can do and what you can't do with fillers and devices and lasers. They go as far as they go, and sometimes having surgery is still can be a holistic approach, because some of that aging is genetic. And what I found with the upper eyelids, I did my upper eyelids, the only surgery I've had is my upper eyelids, because there was nothing else I had to do for it. And I felt less tired. I didn't realize how much that made me feel tired. Just that little extra weight. My eyes were more open and I felt less tired. It's really kind of crazy how much better I felt.
That's incredible. That's really incredible. I love that you mentioned, just by the way, like the idea of the filler migrating, because I think there are people out there that like, that's a myth. The filler doesn't move. And like, as somebody who did too much filler in my like 20s, and I look back and I'm like, oh my God, like I don't even put anything in my face anymore because I think it's still there. I'm like, I don't need it anymore. I could see it like move from like my lip up around like to where my under my nose. And I'm like,
That's a great point. See, that's the other area. So that was, we talked about the eyes, but with the lips too, your lips don't have a lot of space. So when people put in a whole syringe into the lips, there's no room there. So the filler is going to migrate out of the lip area to the area around the mouth, and it will cause a different type of projection. So yeah, that's another area. If you want your lips to have a little bit more volume, it should be done over several visits very slowly, and it should be a product that's better in the lips. Like, I love the RHA line. I think that's a great one. I like RHA 3. Restylane Kiss is good. Yeah, I think those are good products. And sometimes if your skin is a little bit thinner, you want to use a thinner product. So everyone thinks you have to use something really stiff for the cheeks. But I had somebody yesterday who was in her 70s, had some good amount of sun damage, estrogen depleted, never had hormone replacement, and her skin was thin. So I used a very soft filler that you might think was just for fine lines, but for her, it actually gave her volume and didn't look lumpy because she was skin and bones. So anything was volumizing for her, and she was complaining about lumps from previous filler, and that's because the filler showed, because her skin was too thin. We had to build up the structure of her skin in layers and not just put a ball of something in that in your skin, because it's so young and you have layers and volume and you have some in your face because you're a child. So it's not going to show. I can hide it underneath there and create a contour, but in her, there was no place to hide it. So she needed something really soft, and I could just blend it. But it's really just not following a cookbook or a cookie cutter approach. And it's understanding that the filler will often tell you when you inject it if what you're doing is right or wrong. And if you don't like what you see, you can have just done a little bit and you can blend it, but you don't keep going. And you don't say, well, this is what goes here. People often ask, what's the best filler for this area? I'm like, it's
Depends.
yeah, it depends. Like,
Depends.
what's the face look like? What have they had done? What's their bone
How
structure?
old? Right.
Yeah, and are they on hormone replacement, which I think is an area that we should cover, because I think too many women don't understand the power and value of hormone replacement, and I think it's a tragedy.
I love that. So there's two things I want to ask you. And then I absolutely agree. I think we need to talk about hormone replacement, because I look at my mother and I look at her skin and I'm like, if I'm 61 and my skin looks like that, like, God bless. So, and she's on hormone replacement. So first thing is, one thing you mentioned was like having your eyes done. I talked about both my grandmothers have had facelifts. What is the right age for a woman to get a facelift?
So I asked this of my friends who are brilliant plastic surgeons, and they said when you feel like you look like you're about 53. So whatever that means to somebody, but I never want to have a facelift. That's my goal. I'm also 61, and I'm thinking
You're 61?
Yeah.
Oh my gosh. See,
I wasn't fishing.
Like
You just said you're a mom. So.
No, that's amazing.
But the reason I say my age is because I could see if I was 30 or 40 saying, oh, I'll never have a facelift. Like my 20-year-olds are like, I'll be fine aging when I'm older, but do the Botox now. I'm like, okay, You're not going to be fine. You're not fine now. You're not going to be fine when you're older.
Right.
But I would say at my age, if I'm still saying it, I probably mean it.
Yeah.
But I do live in my own candy store, so I could do other things. I also don't put mirrors on any walls, so I don't look at myself all day, because I would probably look like a freak, because our instinct is to criticize.
And so fix, right.
Yeah, we're going to sit there and go, oh, this flaw, that flaw. It's like, it's normal that we do that. We're hardwired to complain about everything, because it's looking for danger and signs of aging, which is signs of lack of fertility and death that follows that, right? So I think that we're living in better times where it's not just about fertility, it's about so much more. And that beauty as you age is different, but I think in many ways older is better. And when you're about 30, you start to have two different ages. You have a chronologic age where older is better, and you have a biologic age, which is how you take care of yourself. And the best analogy I heard is like if you have a piano that's like a grand piano, you have the best piano, but you don't play it well, it's going to suck. The sound's going to be horrible. And if you have a mediocre piano, but you play it well, and you study music and you know how to play the right notes in the right order, it's going to sound amazing. So your genetics are that piano. If you have great genetics and that great grand piano, and you don't take good care of it, you get too much sun, you drink, you stress, you smoke, you do all those things, then the sound isn't going to be good. The aging won't be as good as that genetics could make it.
Right.
But if you don't have great genetics and you take really good care and you sun protect and you have your nice Mediterranean diet, lots of olive oil and avocado and good meats, and I think meat is good, and lots of water and very little alcohol or no alcohol if you can get there, then that mediocre piano or your mediocre genetics are going to age beautifully.
The inputs are more important than the genetics.
Exactly. And about 90% of how your skin ages is the inputs. It's lifestyle. It's how you take care of yourself. So only 10%. The older you get, the more it's genetics. So once you hit about 80 or 90, it's probably just genetics at that point, because you've
had lots of inputs.
Yes, you've had so many inputs. Now it's your genetics. But up until about 80 or 90, you have room to correct and to have an impact on how you age. So the facelift thing is, one, it's a mindset. I have people in their 40s who, to me, look perfect. I mean, they look amazing, and they want a facelift. They want, like, they're watching all this stuff on social media, and they think that a facelift is going to make them age better when they're 60. Maybe it will. I happen to not like how most facelifts look, even when they're really good. I see like little fat pouches, and I see fat loss in the periphery of the face many times. that can happen years later, because in that dissection and the pulling back, that tension can cause some atrophy, some loss of fat in those areas, which I can fix. And if you're super thin, you get skeletonized as you age anyway. You become more skin and bone. So you're pulling skin over thinness. You look smoother, but you don't really look even more
Younger.
youthful or so much
Yeah.
younger. So I start talking about looking more youthful, not looking younger, because your skeleton changes as you age. The bones shrink and the soft tissue expands, and then all the layers in between, your fat, your ligaments, your muscles, they all age at different rates.
Right.
So you're going to change, and you can't not change. But the idea is, if you can change in a balanced way where not one thing stands out, where you can keep some of your symmetry, keep some of your contours, your essence of what your beauty is, and then you understand that beauty as you age is confidence, it's purpose, it's gratitude, it's things that you emote that you can't buy, you could not have at 20. I think it's more beautiful than beauty at 20, because I mean, I've lived a life, I've had careers, I've traveled the world, I have kids, I have grandkids,
Yeah.
I have a great husband, a marriage of 34 years. Like, I have all these things that give me so much joy. And I've survived loss of my sister, loss of my dad, like so many horrors that could break your heart.
Yeah.
And all of that is me. And so I think that's something I've lived through all my bad days. I've lived through all my good days, and I'm here to tell you the story. So, and everybody has a story. And I think that is the most important part of somebody's beauty. And when I
Yeah.
look at someone, I try to see that, and I try to celebrate and enhance that.
I love that. And I think that shows with how you like look. It's like, you're so youthful looking and you're so beautiful, but nothing looks fake. Nothing looks like taken
I
away.
want to do this podcast every day.
No, I'm so serious. Like, never would I have guessed 61. Like, that's how but that's what I was saying about my mom. Like, she's the same way, like married for 30, it'll be 35 years next month. Like, we have, kids, and like, so she has grandkids. And I think that that's a big part of that. Is like, as you age and you have these things that happen in your life, like, that's a big part of your beauty. And so not looking like you're just some plastic face, but like enhancing what is there is so important. And one other thing I want to touch on before we talk about the hormonal aspect, because that's really what I preach all day long, is you've mentioned a couple of times, like, people who are super thin, right? Or like this idea of like bones being, and like pulling skin on top of bones. I think that there has been this massive uptick in people who are using drugs like semaglutide or Ozempic or whatever, and they're losing all of this weight. Can you talk to us a little bit about what that does to the aging process and what that does to skin?
Yeah, it's good for some people, because I do see that they have more confidence, and it sort of
Sure.
jumpstarts their whole journey towards taking better care of themselves, and they like what they see, so they do it. But I also see people getting addicted to it, and people using it as a crutch. So they don't actually make lifestyle choices that make them healthier. They don't necessarily make better food choices, and they don't work out. They just lose weight. And I've lost 50 pounds, and it was years ago before Ozempic, but it was as much mental as it was physical. And when you get yourself into that space of the desire to get healthier, the weight just falls off.
Sure.
So
Absolutely.
if you think that you're relying on something external without understanding that you have to do the work with it, it's eating the right foods. It's making sure that you go to the gym 3 times a week, or work out at home, and do whatever you have to do. But you don't want to lose lean muscle. You want to lose fat and visceral fat.
Yeah.
So the idea of being skinny fat, for some people, it's good, because if you're heavy enough, that weight loss is less pressure on your heart, and it's good. But I see people get so skinny. I have actually a colleague who's a doctor who is basically addicted to it, and she's lost so much weight that she's really skin and bones, and we're actually worried about her. So there's people who take it too far and use it as a crutch, and they think you really can't be too skinny. They take that too seriously. Too skinny or too rich, I guess, is the expression. You can be too skinny. Yeah.
I think that like the reason I bring it up is because I think that what I've heard from my dermatologist too is like fat on the face is actually youthful. It's actually like what helps you to age. Like I remember going into a plastic surgeon, I think when I was like 26, and saying like, I want buccal fat removal. And he was like, absolutely not. It's going to make you in your 50s like look
Can you
like,
imagine? That would be a disaster.
Yeah.
I'm so glad he said no, because so many people would do it.
Yeah. And I think that like, I was just like, oh, my face is too round. Like, I don't like, I can't, but like
Oy.
that, all these doctors like
Your mom
think
just
about,
say, Oy.
yeah, exactly. Like when you're 50 or 60, like fat in your face helps you to look youthful. So, I think that like, that was just the piece that I wanted to.
Pounds are good when you're older.
Yeah.
And if you lose weight too fast, and if you lose too much weight without being healthy. Now, the reality is if you lose weight and you're healthy, like the men who are very fit, who run marathons, triathlons, who do things like that, they have very low body fat, and I can see it in their face. And things like Sculptra can restore that balance so they can sort of have that fit, lean look, but also not have it in their face. So we have ways of balancing for that weight loss around somebody who is very athletic. But the sad thing for me is if somebody is just thin for the sake of being thin, and it's not part of a program to be healthy and fit and have muscle, and understanding that you want to change your lifestyle, not just look for a shortcut. Because from my losing weight, I realized, and I came to the conclusion of like trying all these different ways, like believe all this stuff, like it's just, there's no shortcuts. No. You got to do the work. Like you really have to like not put the, when I was trying to lose weight, I would chew gum, and my dad was like, why are you chewing so much gum? And I go, I'm trying not to eat. He goes, you just have to stop chewing. I was like, Dad, that's so mean. But he was right. I just stopped chewing. So I go to bed, and I found that intentions are really helpful. So every night I still do this. I go to sleep, I take a few deep breaths, and then I just visualize myself tall and thin. And it works. It's like if your mind thinks it, because life is in your head. If you believe it in your head, your body will go there. And then in the morning I wake up, and every morning it's the same intention. It's going to be a great day, and my patients are going to be beautiful. Yeah. So I just see beauty. I just want to help enhance that. But
see, I love that you have the mindset piece in what you talk about, because a lot of people don't. And I think that is like your thoughts create your actions, and that's 100%. The truth. So,
but it's been true in everything I do. When I wanted to lose weight, it was really even when I was a teen. When I was a teen, smoking was the coolest thing. I was a happy smoker, and when I quit, I would just visualize sitting in a room that was like brown and cloudy, and that had these beautiful beads like they would have in the 60s, like those bead curtains. Yeah. And then I would walk through the beaded curtains to this beautiful blue sky and clarity, and I would choose that walk.
Yeah.
And and I could breathe, and I would feel like my lungs, like the pain inside my chest. I would just visualize this and into that blue where it was clear and it wasn't painful anymore. And I never tell people don't do something, because they don't hear the don't, they just hear the do. So if you say, don't forget to pick up the kids, all you hear is forget to pick up the kids.
Yeah.
So if you say, remember to pick up the kids, they'll remember. So I don't say, don't frown or don't raise your brows. I say, squeeze your ears. Yeah. So I'm not telling you, don't make this expression. I say, make this expression. I don't tell people, don't smoke. I tell them, skip that one cigarette. Yeah. Just delay it. Just have it later. And then they keep delaying that cigarette. I just say, you'll just have it later. And before you know it, you've not smoked for a while. But if you think of the idea of quitting, it's daunting and painful.
Heavy.
But if you just skip this one and just have it later, then it's only one. I can have it later. I can skip this one. It's easy. So it's the mindset of not putting a big bucket in front of you and just making things palatable and giving people alternatives. So don't do this, but just saying, let's try this instead.
Yeah, I think that absolutely makes any sort of change easier.
Yeah.
100%.
Hi, I'm Kelly Namiro, your host, certified holistic hormone coach, and Pilates instructor for the WBK method. You can consider me your guide in helping you curate the very best version of yourself from the inside out. Feeling physically better by optimizing your hormones to feeling mentally and emotionally better by creating a more deep and grounded connection with yourself. I get questions all the time in my DMs about things like, what supplements should I be taking for my menopause symptoms? Or is it normal that I'm always exhausted? My doctor said that's what happens as I get older. Or maybe I gained 20 pounds in the last couple of years and I have no idea how to lose it. And even I'm chronically bloated and I've tried every elimination diet. Please help. But here's the thing. There are no quick fixes out there. Until you know the root cause of what's going on in your body and you use precision supplementation, a targeted diet, and mindset and lifestyle changes that are specific to your unique circumstances and lab values, you're never going to be able to heal. Throwing just random supplements that make all these promises or a restrictive diet at a weight issue is never going to work because it's not focused on what's going on internally with you. And often we can make the problem worse when we do these things. And that's why I've created the WBK lab review package. In this package, you'll receive lab kits and a custom lab form based on your symptoms and health history. Once you've completed the saliva kit for your adrenals, the stool kit for your gut health, and the blood tests for your hormones and other health markers, we'll sit down together and create a customized plan that will help you balance your hormones in a holistic way so that you can lose weight, have more energy, maintain a balanced mood, and achieve the results that you've been wanting. This year, it is time to get the results that you've been dreaming of because you're targeting your unique system. If you're ready to experience more energy, comfort, confidence in your body, and relief from those nagging symptoms that have been bringing you down, I would love to support you in doing just that. This program includes a one-on-one call between you and me, all of the labs needed to create your customized protocol, and a PDF with your unique plan that you'll be following going forward so that you can take your time in implementing your new diet, supplements, and lifestyle changes. To learn more about this, head to the link in the show notes or go to wellnessbykelly.com to learn more about the WBK lab review.
Let's get into the hormones game. So I know that a lot of the people who listen to my show are in anywhere between 30 to 60. Like that's really the demographic that I've hit. And I think a lot of women, including myself, know that hormones absolutely impact your texture of your skin, things like acne. I mean, I was somebody who struggled with acne for years and years and years. But what I don't think a lot of women know is that hormones affect the quality and texture of your skin, whether that's wrinkles or crepiness or things like that later on as you move through perimenopause, menopause, et cetera. So talk to us about that.
Yeah, well, one is I used to be a big fan of hormonal contraceptives for everybody because I thought it had so many great protective properties, but I'm not as much now because I think it is a lot of hormone over a very long period of time. And I do worry about that much estrogen over time. And oddly enough, women who will take the pill for 20 years, all of a sudden, when it comes to hormone replacement, which is lower estrogen than in the pill, and it's topical, not oral, all of a sudden, like, no, I can't do that, breast cancer. And I'm thinking, this doesn't make sense, but they're just so misinformed. And the reality is
thank you for saying that.
Yeah, they're so misinformed. The reality is that you lose up to 30% of your collagen in the first 5 years post-menopause. And it's not just your collagen that's breaking down. We know that the American Osteoporosis Foundation came out and said the number one best way to help prevent osteoporosis is hormone replacement. So what went wrong here? I think this is probably the biggest travesty in medical research and journalism, where they took data from the Women's Health Initiative and then misrepresented it and scared women. And this is where the fat in the diets came from and a whole bunch of other bad advice. But around hormone replacement, the study that was done looked at women, because it was a longevity study, who were in their 60s and 70s. So they were 10 to 20 or more years post-menopause when they started the hormone replacement. They were given a horse urine estrogen because that was what was commonly used at the time, but it's not used now. Now we have bioidentical. It was Premarin and other ones, but it was from horse urine. It wasn't the bioidentical synthetic ones.
Right, which is what we have.
Which is what we have now. That's what they had then, but it wasn't what was commonly used. So that's mistake number 2.
Mm-hmm.
They weren't stratified for any risk for breast cancer or even personal history of breast cancer. And then, and they, over time, what they found was that if you look at the average population, how much breast cancer happens, it was 4 out of 1,000 women will get breast cancer. But if you look at women who did hormone replacement, it was 5 out of 1,000. So went from 4 out of 1,000 to 5 out of 1,000. So your absolute risk is still about 1%. It didn't go up, it went up maybe 1%. That's it. But the relative risk went from 4 to 5, which is 20 something percent. So they said, oh, you have a 20 something percent increased risk of breast cancer. When it's not an increased risk, it's an increased relative risk. But your absolute risk is still only about 1%.
And like, I just, the sharing of that information, I think is so powerful for women, because I can't tell you how many people I have come to me in their 50s and they're like, I'm not taking hormone replacement. I know that it increases my risk for cancer, but it's like these synthetic hormones are so different than bioidentical hormones. It's just a completely different game.
The bioidentical can be synthetic. It doesn't matter. It's bioidentical. So it's a patch. So your risk of stroke is essentially gone because it's not oral. It doesn't go through the liver or have that first pass metabolism. And in the studies, the women who had the slightly higher risk of breast cancer, it wasn't even the ones who were just on the estrogen. It was the ones who were taking estrogen plus progesterone. So if you had a hysterectomy and you had your uterus out and you're doing estrogen without the progesterone, your risk didn't even go up. And they didn't report that either. So most women still have their uterus. So they do the estrogen plus progesterone.
Right.
So it's still 5 out of 1,000 instead of 4 out of 1,000. But your risk of dementia goes down, heart disease goes down, osteoporosis goes down, collagen breakdown goes down, quality of life goes up. You don't stop eating estrogen just because you stop making it, and you've had it your whole life, and now you're giving back a minute amount in a patch or a cream, and your quality of life is so good. And it's really quite remarkable to me how much women will suffer. And you talk about women telling you, I'm telling you, doctors don't know this. Even my daughter, who just graduated medical school, we were talking about it, and I said, yeah, I'm never going off my hormone replacement. And she's like, but what about the risk of cancer as you get older? And I'm like, women are saying this now, that you have to stop in your 60s or 70s. Why? Because that's how old the women were when they started it in those studies. So now they're using it as a number, saying, oh, women at this age who took it had slightly higher risk, so we should stop it then. No. Doesn't make sense. So my focus is longevity. And actually, I just helped co-found a new company, and we're working on a novel molecule topically for the skin and the hair. But people are working on the same molecule or similar molecule orally for longevity. So I see a functional medicine doctor, and I do a lot. I've talked a lot about metformin, which I think has
for
some
anti-aging
good data for anti-aging. I was taking it for almost 15 years. I think that there is a lot that we can do, but it's meant to supplement a healthy diet and lifestyle, not as a replacement of. But longevity is, I think, an up and coming chapter. And it's what Peter Attia calls medicine 3.0. So
I was just saying that I loved, like, someone asked me about the books that I've read that I've loved this year, and his is one of them. But
yeah, I'm listening to it and I'm working through, and even the chapters I thought I would skip because it wasn't relevant. I was the most, like the cardiac chapter, I was the most fascinated with.
Yeah.
So he has a lot of great points. He's aggressive. And that's okay, because you don't have to be aggressive like he is in terms of the testing, the screening, and the treating, but just to understand the way that he explains the different elements of what happens with age and cancer cells, and the testing that's done, I think was just really well done and quite interesting. And it is my complaint about medicine, is that medicine, unfortunately, is still geared towards saying, what is your risk factor of getting this? How close are you to that? And it's too late, that we need to start way earlier. We need to start with men in their 20s to worry about heart disease. And he talks in the book about how women's risk of heart disease and dying of heart issues is 10 times greater than breast cancer. And yet we don't talk about breast cancer. And we don't talk about heart disease.
Yeah.
And we just talk about breast cancer only.
It's so true. It is so true. I was talking to another doctor on the show yesterday about this same thing. One is that it's all about care after diagnosis, or like right before a diagnosis is about to happen, when it should be about prevention. And two, what I've loved most about the conversation we've been having this entire time is that it's about the body being this holistic mechanism, that rather than separating it and being like, we're just talking about skin today. Like, no, your hormones play a huge role in your skin.
Right.
Like what you're eating and your diet and your blood sugar and all these things play a huge role in what your skin looks like. And if we could all get there a little faster, I think we would be in a much better place.
Well, we're learning now two things. Well, one is I did internal medicine before dermatology, so I'm always looking through the skin to see what's going on behind it. And I have a patient in the past year where she came in and we did Botox, and she called 2 weeks later and said, I think I got a lid droop. And I had her come in because, I mean, it could happen, but it was surprising to me because I didn't think that would happen. And I looked, and actually she didn't have a lid droop at all, but there was definitely something wrong. And I sent her for a scan, and she had lymphoma. She had a tumor behind her eye.
Oh my God.
Yeah, and the Botox, because we opened her eyes and we lifted her brows, it unmasked it. So you could see it better because everything was up and you could see the fullness. Whereas before, when her brow was down, and she was a little bit hooded, it was covering it. So we were able to find it when she was asymptomatic, and she's fine, thank God. And I've had 2 other patients who ended up having brain tumors, but you could see a little asymmetry. But with the skin, what we find now, and there are studies that are showing this, that we know that if you eat healthy and you have a healthy gut, your skin will look better, that it affects your skin. But now we're learning that if you make your skin younger and healthier, it actually affects your internal aging. That it's not that your skin just reflects your age, your skin can also affect
influence.
your age.
That's really interesting.
So taking good care of your skin can have a really big impact on how your other organs age. And we're learning more and more about that. So I don't take for granted having well-hydrated skin. Your skin is an essential organ. You can't live without your heart, your brain, your skin. These are organs that you need for life. So, so your skin helps with temperature control, water balance, touch. All of these things are really powerful. And if you can't sweat, you can die. I mean, you can't balance your body temperature. So, so you need your skin and you need to keep it healthy. This is why burn victims die, is that they can't manage their body temperature, and they don't have good protection against infection. But your skin has its own immune system. People are overwashing, over scrubbing, micromanaging their skin, when your skin does most of its own managing pretty well. We just need to support it a little bit and protect it, but not to micromanage it.
I love that. I want to end with kind of like a rapid fire. I don't ever usually do this, but I feel like it'll be really helpful for people we've talked about like a variety of age ranges and things like that today. I want to hear your favorite treatment. I'm going to say a skin condition, and I want to hear what your favorite treatment method is, whether it's a laser or whatever it is. Okay. Acne.
Fotona and hydrofacial.
Okay.
And prescriptions.
Prescriptions, like a retinol, or what are we thinking? Okay.
Yeah.
Okay. Hyperpigmentation.
Chemical peels.
Okay. Fine lines and wrinkles around the eyes.
Botox.
Okay. Sagging and droopiness around this jawline area.
Soft wave and Fotona.
What is Fotona?
Fotona is an incredible laser that lifts. Fotona is my laser that is my my workhorse. It does almost everything. I do it for hair growth. I do it for skin tightening. It can melt a little bit of fat. It does beautiful tightening and lifting. It, if you snore, it can help with snoring. We do it for the eyes, for tightening skin around the eyes. It's two lasers. It's an erbium and an ND-YAG laser, and it has different hand pieces. So it fractionates the energy differently. So it could be soft, it could be fractional, it could be firm. So I can do peels with laser peels with it, an erbium peel, that I can do soft peel, I can do a deep peel. So it's really a very versatile laser, but you have to know how to use lasers to use it. So
Sure.
I've had it for about 10 years. I learned about it when I was speaking in Germany, and I saw this laser with like these hand pieces, and I thought, how could a laser do all of that?
Yeah.
Then the more I learned about it, the more I realized that this is a universal, brilliant device. And the engineers and the PhDs who help create these hand pieces are incredible. And we have constant meetings. I'm going to speak in Dallas, and then I'm going to Slovenia.
Amazing.
They bring users from all over the world, and we share how we use it. And everybody is telling our new way. So I came up with a way to grow hair with it.
Yeah.
So we all go, we show our data, we go back and forth and challenge each other, but it's doctors who use this, and it's just an incredible laser. But I often combine it with my Softwave in sessions because they work slightly differently, and I think they benefit each other. And it's nice because it doesn't have downtime, but it's a
I was
brilliant
literally
laser.
just going to ask, what's the downtime?
Yeah.
When I'm not pregnant, I need to come in and get Fatona.
Yes. Yeah, it's great.
Amazing. Okay. And then last one, like what we talked about at the very beginning, like that crepiness around the neck. What are we doing?
So for that, I do laser and filler. I use Redensity. It's a really amazing, versatile, new hyaluronic acid filler that is beautiful for upper lip lines, whereas I didn't have anything before, but it's very stretchy, but it's very soft. So I love that in the neck.
I love that. Okay.
Yep.
Amazing. This was so like I feel like I've had conversations with dermatologists before, and this is not the way that I thought that the conversation was gonna go, in the best way. Like, I love how we really got to all of these different topics of like, and how it was so much deeper than just, oh, like, what treatments are we going to do? Like, we got to that at the end, but there was so much good information here. So thank you so much.
Oh, thanks for having me. This was a lot of fun. It went by so fast.
I know it did. It went by really fast. I'm going to have you back on, Dr. Day. Thank you so much. Tell everybody where they can find you, pimp yourself out. Where can everyone come see you?
I'm at Dr. Doris Day, Dr. Doris Day, on Instagram, Facebook, TikTok, YouTube, my website. So Dr. Doris Day, easy to find. I have a radio show on Sirius XM for 16 years. It's Sirius XM 110, and it's live on Thursday nights. And I'm working on a podcast called Beyond Beautiful. I have 4 books. My most recent one is called Rebooting the Biome. It's all about the microbiome of the skin. And the one before that was Beyond Beautiful, which is my concept of beauty that goes in the skin and things you can do, but also what the connection is to what lies deeper.
I love that. Thank you so much. I will link everything that you just mentioned in the show notes. And I so appreciate your time. Thank you for this.
Thanks for having me. Bye.
I really hope that you enjoyed that episode. You can follow me on Instagram at Wellness by Kelly, or head over to our website, wellnessbykelly.com. Sign up now for the Wellness by Kelly 7-day free trial on our app, or head over to our course. And now get 20% off the course or 10% off of the membership with the code Balancing Chaos, all one word, BALANCINGCHAOS. In our course, you'll get access to an emailed lab review plus protocols built out to help you heal with whatever hormonal imbalance you're struggling with. With our membership, you'll receive a library of content with our app with low-impact workouts, blood sugar balancing recipes, and mindfulness meditations, all designed to help you balance your hormones and help you feel like you are living your most beautiful, joyful, and vital life. If you like the show, please leave a rating and review. That is the best way to help the show grow and get to more listeners. We hope you enjoyed, and I will see you next week.